My name's Marissa Sugden, and I was an intern at the Rural Area Health Education Center during the summer of 2019 while I was attending Nazareth College in Rochester, New York. I received a Bachelor's of Science in Public Health at Nazareth while on a pre-med track, and I currently am working towards getting my Master's in Biomedical Science at Midwestern University in Glendale, Arizona. I'm also doing research in a cardiovascular science lab, working with perfusionists to study the equipment and optimal perfusion levels that should be used while patients are on cardiopulmonary bypass during cardiac surgery. When I was a freshman at Nazareth, I was a biomedical science major wanting to go to med school, but as I went on, I wasn't really sure if that was the right path for me, and ended up changing my major to public health. And as a public health student, we're required to do an internship, and I ended up interviewing and getting accepted as an intern at R-AHEC in Warsaw. And at this point, I was one semester away from graduating with a bachelor's in public health, not really sure of what I wanted to do with it. And one of the many opportunities that I got while being an intern here was that I was able to shadow different healthcare professionals in Warsaw. And during my shadowing experiences, I interviewed each healthcare professional and asked them a specific set of questions related to being a provider in a rural area. And I have never heard of people talk so highly about living and working in a rural area. And doing these interviews is kind of what initially sparked my interest in possibly going back to medical school. And it made me realize that majoring in public health didn't mean that I had to give up on going to med school. If anything, interviewing these providers as well as majoring in public health opened my eyes to what I could do better for the community. And if it weren't for my public health major, I never would have gotten the opportunity to be an intern at R-AHEC. When I started going to college in Rochester, it was a complete culture shock for me. I went from going to a high school that had K through 12 kids in one building with less than 500 students to a college in a city with thousands of students. And I loved living in a rural area growing up, but when I came to Rochester, being in that new environment caused me to kind of have a change of heart, and it made me realize that maybe I did want to work and live in a more populated or suburban area. But when I started working as an intern at R-AHEC, I did a complete 180 again, shadowing different healthcare providers and seeing the impact that they had on not only their patients, but just the community as a whole made me realize that I still have the heart to practice in a rural area. So after medical school, I plan on going back to work in my hometown after finishing, and that's almost solely because of the influence that interning at R-AHEC had on me. Rural areas are in such a high need of healthcare providers, and interning at R-AHEC truly opened my eyes and made me realize that, which is why I would be happy to give back to the type of community that I not only came from, but got the opportunity to intern in. I encourage anyone considering going into the healthcare field that's looking for an internship or needs one to look into R-AHEC. It's been 2 years now since I did my internship there, and I still keep in touch with a lot of the employees there, and I'm so grateful for the opportunities that they gave me and the great experience that I had there.